Thank you, Dr. Chairman. Ladies and gentlemen, today I'd like to present the topic of the assessment of the pulmonary blood flow with transesophageal echocardiography during the palliative procedure, and a novel parameter of the velocity time integral of the pulmonary vein. No disclosures. And at the time of the palliative procedure for congenital heart disease, we usually assess the pulmonary circulation using several parameters: PA binding velocity with epicardial or transesophageal echo, distal pulmonary artery pressure measuring, arterial oxygen saturation, and QPQ-SO ratio calculated by the blood gas analysis. However, it is sometimes difficult to evaluate the total amount and right to left balance of the pulmonary blood flow during the operation. And the velocity time integral of the pulmonary vein has been reported as a novel and reliable parameter for quantification of the pulmonary blood flow in several fields. And the velocity time integral is defined as an area under the curve of the pulse Doppler profile of the pulmonary vein in one cardiac cycle, as shown here. So the objective of this preliminary study is to investigate the usefulness of the PBVTI as a parameter for quantification of the pulmonary blood flow measured by transesophageal echocardiography during the palliative procedure. And this figure demonstrates the patient selection flow of the study. We retrospectively review the case history of patients who underwent the palliative procedure, and the PBVTI was measured at our center from 2011. Early reoperation cases, low body weight infants less than 2.5 kilogram, CPB cases, and patients in whom the investigation was anatomically difficult were excluded from this study. So finally, we retrospectively reviewed the case histories for 63 patients, and they were divided into 3 groups according to their palliative procedure: bilateral PA banding in 18, main PA banding in 22, and BD shunt group in 23, respectively. And PBVTI was measured at 4 points, both superior and inferior right and left pulmonary veins individually by intraoperative TEE before and after the palliative procedure, as shown here. And a single plane 5 megahertz echo probe was used for measurement. Its size is 5.3 millimeter in diameter. And in the bilateral PA banding group, VTI of all 4 pulmonary veins significantly decreased after the banding procedures. And this figure shows the change of the PBVTI before and after banding procedure. The blue bars demonstrate the right pulmonary vein, and the red bars are left. They significantly decreased after the banding. So these data indicates that the PBVTI reflects the total amount of pulmonary blood flow. And this figure shows the horizontal axis shows the PBVTI, and vertical axis indicate the SaO2 levels. And there are significant correlation between the SaO2 level and both right and left PBVTI. And its R value are 0.56 and 0.70 respectively. And 6 patients underwent unplanned early reoperation due to inadequate degree of banding. Patients were divided into 3 groups: reoperation for pulmonary high flow, no reoperation, and pulmonary low flow. And high flow patient had a significantly higher, and low flow patient had a significantly lower PBVTI compared to the patient with no reoperation. Next, in the main PA banding group, VTI of all 4 pulmonary veins are significantly decreased after the banding procedure. And this figure also shows the change of the PBVTI before and after the banding. And they significantly decreased after the banding. And there was no unplanned early reoperation due to inadequate pulmonary blood flow in this group. And in the last, BD shunt group, SpO2 level increased, and VTI of all 4 pulmonary veins significantly increased after the reconstruction of the aortic pulmonary shunt. And the PBVTI of both right and left pulmonary veins increased significantly. And during this study period, 3 patients required unplanned early reoperation due to pulmonary low flow, and they had significantly lower PBVTI compared to those of no reoperation patients. So in discussion, Previously, PVVT had been reported as a simple and sensitive parameter for quantification of the pulmonary blood flow in several literatures. So advantage of this parameter measured by intraoperative TE is real-time quantification of the pulmonary blood flow and assessment of right to left balance. However, a limitation of this method, difficulty for small infant, level of anesthesiology skill, and anatomical variation of the patients. So in conclusion, PVVTI measured during the palliative procedure reflected the change of the pulmonary blood flow, and this index could be a novel additional tool for quantification of the pulmonary blood flow. Furthermore, this could help to identify the patients at higher risk of unplanned early reoperation due to inadequate balance of the systemic and the pulmonary circulation. Thank you.